Hello everyone, my name is Mohan Balaji, Senior Project Manager at HCL. Today I will walk through a real incident that occurred in our regulatory documentation process, how it exposed gaps in our risk management practices, and the mitigation steps which will help us to identify root causes and strengthen our system. Here is the flow for today's session. First, I will explain the problem statement and what went wrong in our DOC documentation process. Next, we will discuss what is DOC and why it is critical under EU MDR. We will then review ISO 14971, which is the standard that guides medical device risk management. And using that framework, I will walk you through the 5-way analysis, the rich picture, the fishbone diagram created for this incident. Finally, we will conclude with the risk register and the key improvements that we are implementing moving forward. So the issue which we are addressing comes from a real HCL project. So during the creation of the declaration of conformity file, a critical attachment device failure mode analysis was missed. This missing file was discovered after the official meeting with the client and regulatory stakeholders. The result was escalation, delays, rework, and unnecessary loss of credibility. This was not an isolated human error. It has highlighted a failure in our internal review and approval workflow. It became clear that we need a such stronger quality management system to prevent such issues. So, before we move further, it is important to understand the regulatory context behind this issue. The DOC we prepare is a requirement under the EU MDR, which stands for Medical Device Regulation 2017-745. MDR is the European regulation that governs the safety, performance, and the quality of medical device sold in the EU market. It is one of the strictest regulatory framework in the world, and it requires manufacturer to demonstrate complete compliance before a device can be marketed or distributed. It is not an optional, it is a legally mandatory document. So, if any documentation under MDR is incomplete or incorrect, the device cannot move further in the approval process. This means any gap delays market access, affects product launch timelines, and directly impact our client's revenue and reputation. The declaration of conformity is the final legal document that confirms that device meets all applicable MDR requirements. It must include every mandatory attachment, technical file reference, and certification evidence. If even one required file, like DFMA, is missing, MDR compliance is violated. In our case, the missing DFMA attachment meant that the DOC was not MDR compliant. Because of this, the regulatory meeting with the client and authority could not proceed. This resulted in escalation, delay, and avoidable rework. So, MDR is the law for medical device in Europe, and DOC is the legal proof of compliance. And missing any component of the DOC puts our client at risk of non-compliance, which is why such documentation errors must never occur. So, to address this incident properly, we used ISO 14971, which is the global standard for medical device risk management. ISO 14971 guides us in identifying risk, analyzing their impact, evaluating their acceptability, implementing control, and then monitoring those risks throughout the life cycle. Because HCL works with medical device clients worldwide, compliance with ISO 14971 is not optional, it is a requirement. So, this standard also reinforces key principles like regulatory compliance, documentation accuracy, consistency, and traceability. So, these principles are exactly what were compromised in our incident. We then applied ISO 14971 structured approach to break down what happened. So, step 1, we need to find what is the risk. So for that, we used visual tools such as Rich Picture, Fishbone, and Five Whys to uncover all root causes, training gaps, missing SOPs, unclear communication, and poor version control. And in step 2, we need to analyze the risk. We assess the severity and the likelihood of the DOC failure. Missing DFMA was categorized as high severity and high likelihood. So step 3, risk evaluation. We need to identify which risks were unacceptable, such as lack of review, workflow, and inconsistent documentation. And in step 4, we need to see what are the possible ways to control the risk. So for that, we proposed SOPs, checklist, template standardization, and a two-step approval workflow. And in residual risk, for example, even after control, some risk remains, such as human error. So we must reduce these to acceptable levels. And step 6, risk management files. We should create a risk register documentation documenting each risk, its impact, controls, and owners. And the last step, post market mindset. So we must continuously update risk through feedback, audits, and lessons learned. So here is our 5 whys breakdown. So starting with the problem, the author failed to include the DFMA file. So first why, the author didn't realize the file was required. And the second mistake is there was an inadequate self-review. And the third one, there was no standard checklist or validated template. And the fourth, because there was no SOPs, structured training, or approval workflow. And finally, the author did not understand the risk or significance of the DOC. This shows clearly the root causes were not technically but procedural and organizational training, SOP, and quality control gaps. So the next is rich picture. So the rich picture visualizes the entire flow and pain points. It shows the author preparing the DOC, the missing attachment, the submission to LRA, the meeting failure, and the escalation loop. Around that, we map the human, process, and communication issue contributing to the failure. Weak knowledge transfer, no review workflow, role ambiguity, and insufficient template control. So this diagram helps us to understand the situation holistically, not just the error, but the entire system around it. And the next is fishbone diagram. So the fishbone diagram categorized each causes into pupil, process, tools, documentation, and communication. So under pupil, we saw lack of training and unclear responsibility. And in process, we found no SOP, no checklist, and no approval sequence. And under tools, we noted missing version control. And in documentation, we saw inconsistent templates. And finally, in the communication, we found expectation gaps with LRA and lack of peer review. So this validated the 5 whys finding and confirmed that this was a systemic issue, not an individual mistake. And the next one, risk register. So after analyzing the root cause, we documented them in a formal risk register. The purpose of the risk register is very simple. It allows us to identify all potential risks, assess their likelihood and impact, determine which risks are unacceptable, and assign clear mitigation action and owners to each one. So the major risk that emerged from this failure included missing mandatory DFMA file, using incorrect document version, insufficient training for new staff, poor communication with LRA, lack of peer review or approval workflow. So these risks were rated based on likelihood and impact, and several were classified as high priority. So the mitigation actions are To reduce these risks, we put in a clear controls. For example, standardized SOP and checklist, version control templates, structured training and onboarding, mandatory review and approval workflow, pre-submission alignment with LRA. So these actions directly lower the risk score and strengthen our documentation process. And when it comes to accountability, each risk now has a defined owner, so responsibilities are clear and follow-up is consistent. The risk register is now part of our ongoing compliance process and will be reviewed before every regulatory submission to ensure error like this do not repeat. So, to conclude, this incident highlighted serious gaps in our current risk and quality management practices. It was not one person's oversight, it was a breakdown across training, documentation, control, communication, and review workflows. Using ISO 14971 aligned tools, for example 5 eyes, rich picture, fishbone, and the risk register document, we rebuild the process end to end. So we are now implementing SOPs, checklists, template control, approval workflows, and structured onboardings. So these improvements will prevent future documentation failures, reduces escalation, and ensure that HCL continues to meet the high regulatory standards expected by our medical device clients. This exercise reinforces a key message, that is, risk management is not a one time activity, it is a culture that must be built into every stage of documentation and project delivery. So the insights and tools shared in this presentation are supported by recognized industry standards, regulatory guidelines, organization quality practices, and academic learning from the ISO 8001 module. So I just wanted to end with the note as every challenges teaches us something valuable and every lesson makes us stronger. Thank you.